Hello, everyone. Welcome to our Unit 4 discussion here in ST 135. Today, we're going to be talking about sutures, which is a huge topic. There's a lot to talk about when we start to discuss sutures. So, our objectives for today are to learn what the sutures are made of, what they're used for, different sizes, all kinds of needles, and being able to choose the appropriate one to hand to the surgeon in the middle of the case. So there's a lot that goes into sutures. I do apologize for my voice. I'm still getting over being sick. I was sick all last week, so I do apologize. All right, so this is your assignments. These are your assignments for this week. There is a discussion on sutures. Reading suture packets is going to be very important, so make sure you pay attention to that one as well. Make sure you're going back and responding to your peer for a full credit, for a full 40 points. Okay, a lot of you are still forgetting to do that, or citing your sources in APA format. So just putting a link to something is not going to give you full credit. That link to whatever source you used has to be cited in APA format. Okay, so let's get into our discussion here. If the surgeon is just holding their hand out silently and asking for a suture, maybe. Sometimes they don't even ask. They just hold their hand out. How are you going to know what to put in their hand? Maybe you have 4 or 5, even 10 different sutures on your back table. How are you going to know which one is the appropriate one if they're not speaking? Sometimes surgeons will just hold their hand out and expect you to know what to put in their hand. Okay. So I like this little meme or whatever you want to call it. The surgeon says, pass me the thing that does the thing. So they are going to expect you to know what they need. Okay. Hand them what they need, not what they ask for. You'll also hear that pretty often too. So a lot of it just takes time, for one, and repetition, but also you need to know some anatomy. You need to know, obviously, your sutures. Um, Anatomy is going to be a big part of it because if you can look down into that body cavity or wherever it is you're working and see what tissue they're working on, that's going to clue you in as to what type of suture they're going to need. That is a big part of it. So anatomy is very important. I can't stress that enough. So let's start with the basics here in suture. You have 4 main categories of sutures, okay? And everything else kind of branches off of this. So you have a monofilament, multifilament, and then you have absorbable and non-absorbable sutures. So these two are referring to, mono and multifilament are referring to how the strand itself is made, you could say. Okay, so if you were to run your fingers on a monofilament suture, it would feel like fishing line, okay? That really smooth, um, just single piece of filament, okay? Multifilament is also sometimes referred to as braided. So it will feel a little bumpy, like it's been braided or twisted around each other. So that plays an important factor in suture selection, okay? Then you have absorbable and non-absorbable. So this is referring to what the body will do to that suture. Certain sutures can be broken down over time, and they are absorbable. They are absorbed by the tissue in the body. They dissolve. Sometimes they're referred to as dissolvable sutures in layman's terms. Or they're non-absorbable, in that they should theoretically just stay in the body forever. What the body typically will do is like build tissue around it and wall it off. Okay. So it'll just be there. Sometimes if it's close to the skin, you might have tissue, you might have suture that like works its way out and you can sometimes pick it out. That happened to my dad. Weird. All right, so here is just it looks overwhelming. I know. You've got this broad suture chart here that is talking about all the different types of suture. Actually, this probably isn't even all of them. There are others, I think, that are not included, but I wanted to give you a good overview as to what you would be seeing, okay? So what I would highly recommend you do is in whatever fashion you like to use, whether it's Quizlet, old-fashioned note cards, make note cards of these things. Quiz yourself. I can't stress enough how important it is for you to know your sutures, okay? So on one side of the note card, maybe you put the name. You'll notice some of these have multiple names. Sometimes it's like what it's made of or a chemical composition. So Monocryl here in pink is also referred to as polyglycoprone 25. I know that's a lot to say. There's some other, like proline is also known as polypropylene. Okay. Sometimes the surgical gut, like right here, is called chromic or plain gut. Okay. Two different types there. PDS is polydiazonone. So you absolutely must know both names because what you're going to see on your certification exam is sometimes they'll give you like the stem of a question and then they're going to go in the answers and give you other names. They want to make sure you know both names. Okay. So it might talk about Vicryl in the question, but your answer might be polygalactin 910, which is the same thing. Okay. Now these are Ethicon sutures. That is the brand. There are other companies that make other sutures that are very similar to these. Okay. So with Ethicon, you have Vicryl, and I think it's Covidian that you would have something very similar, and it's really comparable to Vicryl called Polysorb. All right. So you're going to see both of those. Actually, in most facilities, they'll have both because some surgeons just prefer Polysorb over Vicryl, even though they really do the same thing. They're made the same way. They have the same absorption, surgeon preference sometimes. So the material here is what it's made of. So some of these are your other names, like Ethylon is made of nylon. Merceline is made of polyester. Like I said, proline is made of polypropylene. So that is its composition. Some of these can be naturally made and some of them are synthetic. So look up here at this chromic or plain gut sutures. They are natural in that they are made from beef or sheep intestine. How or why they came up with that, I don't know. But they use the serosa, which is the outer layer of the bowel, or the submucosa, which is the second to innermost layer of the bowel. And they obviously clean and purify it and then use it as a natural suture. Okay. So sometimes these natural ones, including silk right here, it's literally made from silkworm, can be more reactive in the body because people have, allergic reactions to these natural things, I think more so than synthetic. So you might see some people that are allergic to plain gut suture or silk. There's a few others, but that's a good start there. Okay. So the construction is telling you mono or multifilament. So it says braided here. Again, braided means multifilament. So there are certain tissues in which a monofilament might be preferred over multi. It kind of just depends on what you're working on. And then also the size is gonna be important. I wouldn't necessarily put, if you're making note cards, I wouldn't put the size range necessarily. I would focus more on the name, the multiple names, maybe what it's made of, whether it's mono or multifilament. And then under absorption rate, I would also focus on that. Okay. So if it has dates, that means it's absorbable. I would probably also know those dates. I usually make my students memorize these if we're in person. Chromic absorbs in roughly 90 days. It could be 89, it could be 91. All right, roughly. And then if you look a little further down, some of these have a much longer absorption time, like PDS might take up to 210 days to absorb. So think about that when you are looking at the tissue and know what you know from anatomy, hopefully. So if you had two different, let's say you have a tendon that you're suturing, but then you're also going to suture skin later. And you have two sutures on your back table. Of those two types of tissue, tendon versus skin, which one takes longer to heal? Tendons take longer to heal. Cartilage takes longer to heal. Cartilage is avascular, so there is no blood vessels going to cartilage. So that takes a very long time to heal because it has to get all of its nutrients by the process of diffusion. So you wouldn't want to hand the surgeon something that absorbs in 42 days in a suture or in a tissue that's going to take a very long time to heal. Now, obviously, you're not the one suturing, and the surgeon will be like, no, I need this if you hand them the wrong thing. Okay. But what that does is show the surgeon that you are honed in to what they're doing. You know what you're doing. It gives them that confidence in you. And really, when the surgeon has confidence in their surge tech, everything goes so much smoother. Okay. And there might be a time where the surgeon doesn't pay attention. Now that's on them, but you really want to make sure that you tell them or they know what you're giving them. Okay. If it says NA here under absorbable, that just means it is non-absorbable. It will not be absorbed by the body. Now, if it's closer to the skin, like let's say we use silk to hold a drain in place, we do that pretty often. That can come out. That can very easily be taken out because it's close to the skin. Now, some of these, like nylon or even stainless steel in like a sternal closure, those will just stay indefinitely, right? So it even tells you your retention strength. How well will that suture still be holding after, look, 14 days, 21 days? So after 28 days, Vicryl Plus, only has a 25% retention strength. It's not great. Okay. So those are the things I'd focus on if you're making note cards. Okay. And I would highly recommend you do. And just carry them with you, put them on your phone whenever a few free moments here and there really add up when you're trying to memorize something like this. Okay. So pause this if you need to, come back to it, make note cards. All right, moving on. So another thing you have to consider when selecting suture is the diameter of the suture strand itself, okay? We'll talk about needles separate here in a minute, but for now we're talking about the strand of the actual suture. So I like this little chart. It kind of gives you a visual as to what we're talking about. So really there is no middle, so to speak, okay? But our chart goes from, we're going to call this 12-0 versus 12-0. We just call it 12-0. We don't say 12-0. That takes too long. So 12-0 all the way up to a number 5 is typically the range in which we are referring to the diameter of the strand. Now, anything past, well, anything below 0, so kind of like you're in decimals, so to speak, but the dashes are getting smaller. So the further away from 0 you're going to the left here, the smaller you're getting. So to the right of the 0, the further away you get, the bigger you're going. So a 12-0 is the smallest, and a number 5 is the biggest size suture. Even a 0 is pretty big. 0, 1, 2, 3, 4, and 5 are very large. When you start getting below that, they become, very thin. So I tried to give you some examples as to when you might see these particular sizes, and it could vary, but most vasculars are going to be in the 6-0, 7-0, and 8-0 range. And sub-Q or skin could be anywhere from 3-0, 4-0, or a 5-0, depending on the skin. So if we are suturing the face, it's pretty delicate. You don't want a big scar. Probably wouldn't use a 3-0, okay? Most surgeons would use either a 4 or a 5-0 for facial skin. But if I'm closing the palm or maybe the bottom of the foot, that type of skin that was really thick, that extra layer of skin, you would probably want a 3-0 for that type of incision. Fascia is a really dense tissue that surrounds muscles. You close it in the abdominal layer. There's a lot of tension on the fascia, so a lot of surgeons use a 0 for fascia. Ortho, like if you're getting into those tendon repairs, big things like that, bigger suture, okay? This number 12-0, I don't even think I've used. You have to have a microscope, very delicate needle drivers for these. And I think a 12-0 is what I've heard can float in air. So it just kind of like floats through the hair because it's so thin. It would be better for eyes or something incredibly microscopic, right? To give you some perspective, the 7-0 here in vascular is the size of a human hair, just to give you a little perspective either way. So you'll definitely need to memorize this as well. Here are some suture packets just to show you what some of these look like if you've never seen a suture packet. Sometimes they're packaged a little bit differently. Sometimes you peel this off completely to expose the needle. There can be more than one needle in a package. If so, usually you'll have a picture of another needle here. So this picture of the needle shows you what the needle looks like. Okay, so your name of the suture is always usually in the middle or pretty bold. You kind of look at that first, so to speak. You got your size of the diameter of strand. So like here, this 4-O-Proline has pictures of 2 needles. So there should be 2 in here. When you go to count those, these are a countable item. You must always visualize your needles to see what you're counting. So I like this little picture. It does show you. Then down the middle is that human hair. So it gives you some perspective there. And we're going to look at suture packets here in a little bit as well. So let's talk about needles. This is the next important consideration. So you've taken into consideration the type of tissue, the mono multifilament, absorbable, non-absorbable, maybe even with the size, right, of the diameter. So you also have to consider the needle. So suture takes a long time, I think, for students to grasp because there are so many things that have to be considered and so many combinations of those things. So if you take it just, one step at a time, memorize each of those, put it together, and it comes with practice, okay? So the needle is typically attached to the suture material, okay? When it is attached like that, pre-attached, it is called a swaged needle, okay? It's a strand of material that is eyeless. You do not have to like thread it like a needle, like if you were sewing by hand, it is pre-attached. Now, there are some needles that are free needles that don't have that material pre-attached that you do have to put in. Those needles tend to be a little more traumatic to the tissue because the eye is bigger that you have to put the strand through. Not a lot of doctors use that anymore. In my experience, they've kind of gotten away from that. Some docs may still do that. So you may have to learn how to thread the needle, okay, to thread a free needle. So a controlled release suture looks like this, but if you were to pull quickly from the needle away from the strand, it would pop off. So we call those pop-offs. Some type of wound closures require like one suture pass, like if they're just going to make one like swipe with that needle and they're going to tie that off and cut it, that is an interrupted suture and they need multiple needles. So using a big pack of pop-offs be beneficial there. So you would have a suture packet with maybe 5 or 8 needles in it. Those are usually pop-offs. Conventional cutting is, so we're talking about the tip. So you have 3 parts to the needle here, 3 main parts. You have the tip, the body, and the swage, which is where it's attached. The tip can be in a lot of different fashions, okay? You have a conventional cutting where the needle is a triangular point and 2 cutting edges. So it depends on the type of tissue that you're going to use. Like for example, look down here at the spatula needle. It's like, I'll show you a picture of what it looks like here in a bit, but it's kind of like cut off. It's really bizarre, but it's usually good for eye tissue. Spatula needles are often used for the eyes, ophthalmic. Cutting needles are often used for skin because of the way it goes through the tissue. Maybe a taper needle is good for subcutaneous tissue, okay? So Keith needles don't have this curve to it. It's completely straight. It literally looks like if you're gonna suture something by hand or sew something by hand, it's that straight long needle, okay, a Keith needle. Reverse cutting is just talking about where the cutting edge is in relation to the curvature. And then the taper cut has 3 cutting edges and the rest is tapered off. So it kind of slides through the tissue a little bit better. So they do have different uses and that's why it's important to choose the right needle. So here's a picture of some of these. It can be a full half circle, full half, is that even a thing? A half circle. It could go beyond the half. It depends on where you're working, how tight the area is that you're trying to get that needle in. Here's your straight Keith. I've never used a half curve. I don't know what that could be used for. Maybe ENT knows. I don't know. Anyway, so here, if you're looking at the needle, you've got your swage where it's attached. The diameter of the needle can change just like the suture strand. The radius, which would be like half circle, point, length, all of those change. Okay. So on the package and I'll point this out to you when I show you another package. You're going to have these symbols. See this bottom row here, these triangle circles? That shows you what type of needle it is. Just a quick image. Okay, so Normal triangle is a conventional cutting. Upside down triangle, reverse cutting. Then you have a circle with a hole in the middle is the taper. So what these are is if you were to look at the needle straight on, like looking straight at it, the needle's looking straight at you. That's what the tip looks like. Okay, so you have cutting edges here on your conventional and reverse. The taper has a point to it, but it gradually gets bigger. The blunt does not have a point to it. That's why there's no circle again. The blunt is for very delicate tissue or tissue that would break apart if you were to put something sharp in it. So like the liver, maybe even the spleen would need a blunt needle. Okay, so you also have these codes of those needles. There's a lot that you can choose from, and they kind of clue you in. You don't have to memorize these necessarily, but over time you will notice what they mean because if you're doing a lot of vascular, you're going to notice what that needle code is that you use, that your surgeon uses all the time. Um, Spatula, S. Something good for plastics, P. Just to point out a few here. Got that Keith straight needle, KS. I'm trying to think. Let's see here. FS for skin. You'll see that pretty often. Just yeah, you are urology, so they kind of tell you often what they see cardiovascular. You know, lets you know what they're used for. Okay, so here's back at our other suture packet. So like I said at the beginning, you might have more than one manufacturer in your facility. Covidien was one. That chart that I showed you was Ethicon. So Surgipro is polypropylene for Covidien. You had Prolene for Epilon. Same thing, polypropylene. Okay. So you do need to memorize that. I wouldn't focus too much on the reorder number unless if that's part of your job that you have to do. Your needle code, like I showed you before, P10, the needle shape is cutting needle. So, I mean, it could be used for skin, but considering the size, it probably wouldn't be. Pearling is used very often in vascular things. Needle size, so it shows you this picture of the needle is what the needle looks like. That's its curvature. That's its size. So it is true to size, okay? Here's your needle point. Remember that. So that upside down one, do you remember what it is? Go back and look. Should be reverse cutting. So upside down triangle, reverse cutting. Okay. Also check your expiration date. That's very important. So just because a suture is expired, it doesn't necessarily mean it's contaminated. Okay. What it might mean in most cases is that the strand can no longer be considered, I don't know what the word would be. It might break apart easier. It can't, the integrity, yeah, that's the word. Integrity of the strand can't be verified. So, you put this in an incision and it's expired, there's a very good chance it won't hold up. It might break. So always pay attention to that. Shape, that's its 3/8. We showed you the curvature of that. The suture length, 18 inches. Sometimes they need a really long length, depending on the incision. The suture color is blue. Sometimes they're colored, sometimes they're clear, sometimes they're purple. It just depends. Material, so that's what it is. So it is monofilament. A lot of packages will tell you whether it's mono or multi-filament. Polypropylene, other name. So get used to looking at these things. You're looking for all these important tidbits when you're picking up the right packet. Size, name of the suture, needle. Those are the big ones I'd focus on first. Okay. All right, so one other thing here, when you're trying to pick the right suture to hand to the surgeon, like I said before, certain types of tissue in the body take longer or shorter to heal. Skin, like if you have a small cut on your hand, you know how quickly that typically can heal. It doesn't take very long, maybe a week-ish, and then you'll start to see that scar. Tendons, ligaments, up to 12 weeks. Cartilage, because it's avascular, 6 months. Nerve, if depending, could heal months or years, depending on the type of nerve damage. We won't get into that. So keep that in mind when you're choosing whether you need something with short absorption time or maybe not even non-absorbable. It needs to stay there for a good amount of time. Okay. Wound healing also will affect suture. If it's infected, if you have a big infected wound, A, they may not even close it, but B, you would never want to use silk. Never use silk in an infected wound. Braided suture like that, bacteria can travel down those braids, especially if it's like on the skin, and it could get deeper. So the bacteria has a portal basically from the outside to deep within the skin, or deep underneath the skin, I should say. So braided tissue does have, it's like a wicking thing. It can wick the moisture deeper into the tissue, which could lead to an SSI. So that is also a consideration. All right. So I know that's a lot of information. So if you have any questions about suture or need anything clarified, please don't hesitate to reach out. Go back, make note cards, and really take your time learning those sutures. It's very important. With this online class, it's really hard for me to harp on you about doing things, but that's one of them you for sure need to do, okay? So again, reach out if you have any questions. Have a good week.